All right, do we have a quorum? Shall I start at 7?
Yep, you have a quorum.
All right, I'll start, everyone. So I will begin by reading the protocol of the Zoom meeting. Here we go. In accordance with Governor Baker's executive order permitting virtual meetings during the COVID pandemic, the Board of Health is conducting this meeting this evening, October 20th, 2020, on the Zoom platform in accordance with the town's policy directive and guidelines issued April 1st, 2020. I ask that all Board of Health members, town staff, and presenters activate their video and mute their microphone unless they have something to say or are participating in committee dialogue. This meeting is being recorded and will be available for later viewing on the town website. All committee votes will be taken via roll call, and we'll start with an attendance roll call. When I announce your name, please reply. For members of the public, please unmute yourself only when I've opened the meeting to public comment. So I am here today. Jill Block.
Present.
Ray, are you here yet? Nope, not yet. Mark Haddad.
Here.
Alma Healy.
She's going to say present.
So now can you hear me?
Yes.
Okay.
All right. And we have Susan Rask and Karen Byrne. All right. I think we have a quorum and we're almost all present and accounted for. And Ray can join in a little bit. So the first item on the agenda is discussion from Concord resident Phil Posner. Is it Posner or Posner, sir? Regarding Concord Bikes. So thank you. You have the floor, sir.
Thanks very much. Thank you for inviting me and accepting my request. I am a member of Concord Bikes, which is a citizen organization. I was also appointed by the select board as a member of the transportation committee, but I'm here speaking on my own behalf as a private citizen and not as a member of that board. One of the things that Concord Bikes has done as an organization since last fall is that we've undertaken quite a bit of outreach to various boards and committees, various organizations in the private sector and individuals to promote the use of active transportation throughout the town. Among the activities that we did in getting started is that we took time to review every report that had been done with regard to bicycling, walking, active transportation, and related matters that have been created and filed with the town. And we discovered that there has been quite a bit of discussion with regard to the issue. There were initiatives taken by the Board of Health, for example, the Fenton study done in 2014, which promoted the idea of active transportation and promoting walking and biking through the town. That idea was also transmitted into the town's master plan, the Envision Concord plan, a few years later. What we also discovered was that although there had been a lot of discussion with regard to these issues, there hadn't actually been a lot of active work being done in order to accomplish the goals. So as a concrete goal, one of the things that Concord Bikes promoted working with a group of parents was a bike to school program. And I can report to you that your board's interest in promoting biking and walking to school is something that's actually happening every day in the town's primary schools. We are tracking it. We're counting the number of bikes. We have data for you when you're ready to receive it. So it's not a theoretical thing. It's an actually happening on the ground thing every day. And what I wanted to do, aside from introducing myself and introducing this topic and asking the board when it has some time to re-examine its own efforts from 6 years ago, is to ask for your support in a somewhat concrete way our group has reached out to the state Safe Routes to School program, which is a statewide program that's promoted by the Massachusetts Department of Transportation. We have become an alliance member of the Safe Routes to School program. And we're hoping that you will also become an alliance member of the Safe Routes to School program. I don't know whether or not I can send you an attachment through Zoom, but what I can do is send those attachments either through your staff person or whoever you would like me to send it through, the chair, so you can see exactly what I'm talking about. But the application form is very simple. It's a one-pager. The types of activities that you could undertake are also fairly straightforward and simple. You're not obliged to do anything. However, your agreement to become an alliance member, I think, will encourage the school department to take steps to incorporate Safe Routes to School in their own activities. So the last thing that I wanted to say is I wanted to thank the board for its interest in the topic and for inviting me to speak for a few minutes. And if you have any questions about what we've been doing to date or what the big picture might look like, I'm happy to speak with you.
Yeah, I mean, I don't think any of us would argue about the health benefits of biking, and it's great to get kids outside. I know, when my kids were in elementary school, they all loved biking to school. It was just kind of like having a little bit of independence and activity. They really liked doing that. It would be great if you could forward those materials to us, and we can take a look at it. I guess. What I always in the background of my mind is thinking about safety as well. I think there are communities that have really safe, well-designated bike routes near their roads, adjacent to their roads. And then, I'm not sure that Concord has a lot of those designated paths and marks on the road. And, I do worry about kids' safety going to school. I don't know what other board members' thoughts are at the moment, but anyone can weigh in.
I guess I'm obligated to weigh on this, Susan, wouldn't you say? And Phil, I have intimate knowledge of what Phil is talking about because my husband Wade is very involved with Concord Bikes as well as his own bike connector program, and he was part of Envision Concord, and all of this was based on the Healthy Concord project that I ran with Susan for the health department as a consultant. I wasn't a member of the board at that point. So certainly that project concluded that roads that were safe for all, pedestrians, bikes, etc., was a priority that came out of the Healthy Concord project, and a lot of those plans did get recommended through Envision Concord, and some of those road improvements, Concord Sudbury Road being one of the big ones, and we did that whole walkthrough with Mark Fenton years ago. It was pretty fun and fascinating, actually, and there's a lot that could be improved in this town for sure. So I'm fully in support of this, obviously, because I guess I've had a lot to do with it. I'm not involved with what Phil has been working on now, certainly other than conversations in my driveway when lots of bikes are being worked on. But I'm fully in support of encouraging this. Certainly COVID with the schools promoting or asking outright for kids to not go on the bus and to develop other ways of getting to school. It certainly, expedited the use or just to increase the use of kids that are doing this. I've been seeing one boy, he must be going to the middle school, biking up Old Marlborough Road every Thursday. I see him going on Ministerial, Harrington, Old Marlborough. It's a tough route until he gets to the Bruce Freeman Trail, and he's not wearing a helmet. That's one of the things that really worries me. Like, I know that we need to be getting more messaging out there, or somehow, I'd love to see that somehow enforceable. And that, of course, is another challenge. So anyway, I can talk a lot about this. That's all I'll say now.
Yeah, I would agree with you about the messaging on the helmets, but you know, I would like to see road improvements too. So yeah.
So one thing that I would like to just bring your attention to, and I'm sure that Jill can also speak to this because it relates to her neighborhood. And I see that Josh Bergel is on the line, and Josh is another fellow who lives in the neighborhood who's been working on this. There is a specific intersection on Sudbury Road as it intersects with Garfield Road, which has been the subject of conversation in the Transportation Committee. It's been the subject of advocacy by various people to undertake a safety initiative at that intersection. One of the reasons why I've been promoting the idea of joining the Safe Routes to School program is that once the municipality joins the program, it becomes eligible for some grant money for signs and lines program, for example, which I think is similar to what you had mentioned, Deb. That specific intersection is being studied by the town engineer and the DPW for improvement. It was also an intersection that was included on the Complete Streets list, priority list. It was actually the #2 project on the priority list for a safety upgrade. And what was discovered as a result of a closer examination is that more work than originally anticipated needed to get done. More work needs more money. And one pot of money that might be available is through MassDOT Safe Routes to School program. So, you know, coaxing the town into becoming a part of that program would open the spigot of grant funds to help complete that program, that particular project in an expeditious fashion. But as a bigger picture matter, I think you're right. I think there are a lot of places in town that need to be examined. We're working to not only promote bicycling in a vacuum, but to also promote safety. And we're hoping that the Board of Health it can work with the school department, can work with the town to do exactly the kind of thing that Jill mentioned, which is to send out messages to kids that they should wear helmets, send out messages to parents that they should help their kids wear helmets the right way, for example, right? Because a lot of kids will wear their helmets on their handlebars. It happens, right? A lot of parents wear their helmets on their handlebars or don't wear them at all. So the messaging, I think, is important. And one of the things that we're hoping to promote is consistent, clear, and compelling messaging through the town, either using the materials that are already cooked up by the state or supplementing them with materials that we develop at the local level. And we'd like to collaborate with you on doing it.
Sure. Well, that all sounds very reasonable. I think, you know, if you can send the information over to the Board of Health, and then we can probably put it on the next meeting agenda to sign.
Terrific. Thank you. And so I'll send that right after this Zoom meeting.
Okay. All right.
And do you want me to send that to you, Deb, or should I send that to somebody else?
Probably send it to Karen. Would you be the best person to get that out to everyone, or Susan? Who would be best?
Either one of us. You could just copy us both, Phil.
Okay. So I think I'm pretty sure I have an email from you, Karen, with this Zoom.
You do. I'll make sure everybody gets.
I'll respond to that. Great. Thank you so much. I appreciate it.
Right. Great. Yeah. Sounds like a good project. So
thank you.
Happy to help. All right. Thank you for coming.
Okay. Thanks a lot. Have a great night, and everybody stay safe and healthy.
Thank you. So let's move on to discussion of COVID-19. Susan, how are we doing in the schools?
How are we doing in the schools? Let me find the piece of paper. So Since the beginning of school, the first week of school, we had one student in grade 8. The week of October 9th, we had 2 siblings, one in grade 9 and one in grade 6 who were positive. At the end of that week, we also had a staff member at Thoreau. And then this past week, we have a grade 12 student at the high school who's a hockey player who we believe was exposed at a tournament in New Hampshire. From all of those cases, the good news is we quarantined 65 close contacts in the schools and none of them became positive, which I think is really good news. Like each case in the school we've kept as an isolated case.
Good.
So I feel good about that. We also had one in the 9th grade at Fenn the week of September 28th. They basically put the entire 9th grade, 20 kids on remote learning. They had no cases in their close contacts. So that's more good news. Neshoba Brooks has had none. Middlesex has had none. And they're doing weekly testing for all their students. They have their boarding students back. Concord Academy, we thought was going to be remote learning all semester, but in fact, they are bringing boarders and day students back. The boarders are coming back this weekend. They intend to hold classes in person through Thanksgiving and then go remote from Thanksgiving on until sometime in January. They will also be doing weekly testing on their students. So that's where we are. Talking with Trish, Lincoln Sudbury is not in nearly as good shape. I think she's got 3 cases in the middle school and maybe more in the high school, some of which seem to be related to a basketball facility in Sudbury. So they're actually thinking about going remote at Thanksgiving through Christmas break, and I'll let you know what they decide about that. But so far, so good for us.
So far, so good. Okay.
Hey, Susan. So on the schools, has any of the contacts gotten sick, or has it been clean as far as the contacts that have quarantined for 2 weeks?
None of the contacts have gotten sick, which makes me feel really good. Like we're keeping it as isolated cases. So I feel good about that.
Yeah. Awesome.
Yeah. Yeah, it gives me some confidence that, although I think we're going to continue to get cases, we're going to be able to keep it under control, I hope, knock on wood.
Good. Well, it would be good to keep the kids in school as long as possible. I mean, in the school as long as possible. So
Yep.
that's good. All
That
right.
sure seems to be what parents want.
Yes. Definitely. All right. Well, I definitely have seen an uptick in the emergency department and COVID, so I think we will see more cases. So anyway. And so Halloween, I just wanted to touch base on Halloween. I kind of looked at the CDC and the state guidelines, and it doesn't seem that we would, take any kind of action to ban Halloween in the town. But I thought it probably was good if we just had a discussion on our agenda. Does anyone have thoughts about strongly or negatively or whatever about Halloween activities?
I will just tell you that Stephen Crane queried all the towns surrounding Concord, and none of them are prohibiting trick-or-treating. They're all putting out messaging pretty similar to what I sent to you this afternoon.
Yeah, okay, all right. So option for people's houses to participate or not participate, and social distancing. People can put stuff at the end of their driveway if they want, kind of thing. Okay. Yeah, I talked to my colleague from the Board of Health in Needham, and that's what they're doing as well. So I just want to make sure that, if one town is prohibiting Halloween, that, all the kids don't move to Concord, because they do drive to different towns. So,
They do.
yeah. Okay. Any thoughts or comments on Halloween?
I think even if we banned it, people would be doing what most of what those moderate risk activities are anyway. I think people are going to do it in their neighborhoods.
Yeah.
Very hard to stop it.
Yeah, it's hard. The kids have had a lot of things taken away from them. So, and I think probably trick or treating's, lower risk than having a Halloween party in your house. So I think it's fine.
And I think always in the past, families make their own decisions. Some are doing some of the things that are suggested here in order to keep from going out on the streets. So I
Yeah.
think it would probably be very similar.
Yeah. All right.
So is this going out, Susan? This thing that you made?
Yeah, I sent it to Stephen and Aaron, and I think it'll be out in the public tomorrow or the next day. Stephen wanted to hold off, and I kind of broached the subject with him a couple of weeks ago, and he wanted to hold off until he knew what other towns were doing, and till we sort of gave the COVID picture a couple of weeks to see where it was going and how Concord was looking. But so far we still look pretty good. So
Okay.
I mean, if we were a red town, we might be putting out different advice.
Yeah. So it's, 10, 11 days away. It's pretty good. All right. Next item on the agenda is whether we are going to sign on a letter to the state regarding support for public health. Susan, was this you or Ray?
This was from Ray, so maybe he would want to speak to it.
Okay. Is he here?
This is the SAFE Act, and excuse me, it comes out of the special commission that the governor set up back in 2016, and it was I think 25-member commission with state reps and senators and public health officials, and they issued their report in the summer of last year, 2019, and I think we sent the letter out. I'm looking, yeah, the letter. This act would, address the unevenness in public health in Massachusetts. There's, you have some communities that Boston and Springfield and Cambridge that have very large departments, and then it falls off greatly. And there's a lot of communities, particularly in the western part of the state, that have a half-time public health officer, oftentimes not even trained, and so there's a great deal of unevenness in the quality and the funding for public health, and all the public health departments, all health departments in Massachusetts are locally funded. We get money from tobacco and some other areas, but by and large, most of the money comes out of the city's general fund. So this would be this bill, and there's three, Senator Comerford and Rep. Kane and Rep. Garlick have filed this legislation. And what we would be doing is just urging our state rep and our state senator to sign on to the bill through our letter. And the bill would do four things. It would provide state funds for local departments. It would look at credentialing so that there would be minimum standards for public health officials in every town. And there would be, I know we use Maven right now, but there would be a uniform reporting system that everybody would be required to use. And then I guess there would be finally different standards, uniform standards for each department. So Massachusetts is kind of unique. We have 351 cities and towns, and the state constitution says that each one of them has its own health department.
Yeah.
There's only about 2,800 health departments across the country. So, for Massachusetts, we have a significant percentage of that 2,800 in just one state. And it's a plus and a minus. I guess we have a lot of local control that we can exercise, but at the same time, there's a lot of a lot of health departments that are inadequately funded and inadequately staffed. And I guess this bill would help to look at creating some kind of parity and standards across the state.
Yeah, it sounds like a good idea. I mean, it would benefit the entire state if everyone was a little bit on more equal footing, especially when we have, global pandemics.
So this is just a letter to support, asking our state rep and senator to support this.
Kind of like a no-brainer, public.
Yeah,
health.
I think so. I
It's like,
think so.
All right.
Need to vote on it.
Okay. Do I have a motion to sign on support of the SAFE Act?
So moved.
All right. Okay. All in favor? Jill?
yep, yes.
Ray saying yes. Mark?
Yes.
Okay.
In favor.
Yes.
All right. All in favor. So we will sign on to that. Great.
Great. Thank you.
That's good. Thanks for bringing it to our attention.
Deb, are you okay if I sign the letter on your behalf?
Yeah, absolutely.
That way you and I don't have to actually meet in person.
That makes me
Not
sad.
that I wouldn't like to.
One of these days.
No, I miss you all, actually. I miss you a lot.
Me too. Me too. Well, I'm sure you've been busy, Susan, with COVID. Anything, or sorry, board member reports. That was anything else on that? No. Staff reports, Susan?
That's Trish and I just pretty much do COVID. That's really our life right now. Our goal is to keep the schools open. That is our goal. And Stan has been out since June on medical leave. So Karen and I are kind of picking up his job. So we're busy.
Yeah. I bet you are.
How's it-
Cranky sometimes.
Well, there's a lot of construction, right? So,
Yes, there is.
and how are the restaurants doing, Susan, with indoor dining? Have you heard anything or seen anything?
Honestly, we have not been out inspecting. We're trying to transition to an online permitting system, and Gabby's doing a lot of that debugging of that, because that really has to happen too. That got put on hold for COVID, but we're trying to make that transition by December. We're not getting a lot of complaints. We got complaints in the beginning, not too much. I think it took businesses a little while to get on board with it. I'm not sure what they're all going to do now that winter is coming, whether they're going to keep the tents or not. Once you put the walls down on the tents, it's considered an interior space, and they're going to have to go with those guidelines.
Yeah.
What else? What else do you want to know?
What's happening in anything happening in tobacco inspections for menthol, the flavor ban?
Erin is starting to get out to do the preliminary outreach to all of them, just sort of to tell them what the law is about, to provide them with the signage. Like, wherever we left it last winter, she's got to start all over again. So she's just, she's starting with the education first.
What about the vaping in the schools? Is that an issue still?
The kids are only in school half the 2 days a week. I just think, my impression is the schools are just doing everything they can to keep their head above water.
Probably makes sense.
Yeah. I don't get the sense that kids are vaping a lot. I'm definitely not seeing it in the emergency department. It's not a common thing anymore. It's interesting.
Yeah.
That is interesting.
That's one good thing COVID did.
Yeah. Yeah. I don't know. We'll see. All right.
There are no minutes, so you'll be happy to know that.
Oh my goodness. What will Mark do?
Well, he's going to get two
I had no-
soon.
All right. Anything else from anyone?
How about our next board meeting, the 17th? Are we good with that date?
I think so, yeah.
So we'll be Zoomy.
It's fine with me. So,
Okay.
Works for me.
Yeah,
Good.
works as well.
Yeah.
okay, all right.
Okay.
Good.
So we can adjourn until November 17th.
Yeah. Yeah.
All right.
And
Well, thank you for meeting tonight. I just, I felt just kind of with Halloween coming up and in the middle of COVID, I feel like we should at least have meetings on the books, you know. We all know Susan and Karen aren't slacking by any means, but I think it's probably just good to weigh in. So.
No slacking, but you have
No
to
slacking.
adjourn with the roll call, with the roll call.
Okay, all right. So do we want to adjourn the meeting? Jill, what say you?
Yes.
Ray, Considine,
Yes.
Mark,
Yes.
Alma.
Yes.
All right, I vote to adjourn as well. Good night, everyone. We'll see you next month.
Night.
So long,
Thank
everybody.
you.
Bye-bye.
Bye, thanks.
Bye, Sue. See you tomorrow.
Bye, see you tomorrow.
Okay.